Hi everyone. This is Daniel from Lifestyles Medicine. Just want to say hi. Welcome to this session. We are getting started in just a few minutes. We'll get started shortly after 6 o'clock. So sit tight and please do note that this session is being live streamed on Facebook and also recorded as well. So thanks again for coming, and we'll get started in just a few minutes. Thank you. Just want to welcome everyone who's joined us. For those who just joined, thank you so much. We get started in just like 1 or 2 more minutes. And just please note again that this event is being live streamed on Facebook and also being recorded as well. Thank you everyone so much, and just sit tight. We'll get started in just a bit. Thank you. All right, Dr. Cho, Carolyn, you there?
We're here. I'm here.
Absolutely, yes.
Okay. All right, so I think we can get started. So again, just want to welcome everyone to another Lifestyle Med live event hosted by Lifestyle is Medicine. We're so glad that you would spend your evening with us. Before we dive in here, oops, my slides are backwards. Just want to just note a few things. First, this session is being recorded, and also this session is being live streamed on Facebook. So please just take note of that. And we are going to start with some presentations, but we love the Q&A. We want to get to your questions. So as you listen to the presentations, we really encourage you, if you have any questions, just put them into the chat box, and we're going to try to get to as many as possible. We're probably going to have around 20 to 15 minutes for questions. So please, we love to get to your questions. And please do note that this webinar is for educational purposes only. We'll be sharing many inspiring stories, but of course, it's only for education. And please speak with your healthcare provider before applying any of the information that's shared in this session. Just want to recognize our partners for this webinar. So first, my name is Daniel from Lifestyles Medicine. Lifestyles Medicine is a Toronto-based not-for-profit, and we put on community-based lifestyle medicine programs, basically inspiring and educating people so they can prevent and reverse today's most common chronic diseases. Our clinic partner is Pathways Lifestyle Medicine Clinics, and you see the information there, the URL and the phone number. They have 3 locations in Toronto and really focus on using lifestyle as medicine to prevent, treat, and reverse chronic diseases. And we're really pleased to partner with Energy Shack Juice Bar, and I'll let Carolyn share more about that later when she speaks. But basically, Energy Shack Juice Bar is a plant-based juice bar, and they have prepared meals as well, really great. And Carolyn, I'll let you share more about that when you are going to speak. So we really pleased to partner with Energy Shack for this event. All right, so today's session is titled Using Food as Medicine, and we'll be hearing very inspiring stories from the clinical setting where people have used food and simple lifestyle changes to reverse common chronic illnesses. And we have 2 presenters to share those with us. First, we have Dr. George Cho. He's the clinic director and naturopathic doctor at Pathways Lifestyle Medicine Clinic. And his practice really focuses on using evidence-based lifestyle medicine for the prevention and treatment of chronic diseases. Dr. Cho will be followed by Carolyn Nichols. She is a certified holistic nutritionist and the owner of Energy Shack Juice Bar. And she has some really incredible stories of how she's helped clients really improve their health by using really just the power of food and healthy lifestyle change. So Carolyn and Dr. Cho, we thank you so much for joining us. Again, after the presentation, we want to get to your questions, so please do throw those into the chat box. So first, I'll turn it over to Dr. Cho. Thank you so much.
Hello, everyone, and Daniel, can I share my screen if possible?
Yep, you should be good.
All right. Hello, everyone. So it's good to see all of you, and I'm glad that you're out. So yes, as Daniel said, we're going to share stories of how we're using plant-based nutrition to help not just prevent, but also reverse various chronic diseases, and we will show you some stories of that. We hope that it will be inspiring to you. I'm going to try to be as short as possible because I want to give the most time to Carolyn. But I want to show you some of the things that we're experiencing in clinic, and hopefully it'll be a source of encouragement to you. So the question today that I want to answer is healing possible and is reversal possible? And I think we need to pose this question because right now in medicine, um, really we're not healing people. What we're doing is actually we're just managing diseases and not healing. But we want to ask ourselves, if we get away from the common way that we deal with medical conditions, i.e., drugs and so forth, can we still experience healing and reversal? And I believe that the answer is yes. All right. So when people come to the clinic, we give them some very simple instructions. All right, it's not complex. It's very it's easy to grasp. Okay, and so we share with them this plate here that you see before you. Okay, and it's as you can see, it's plant based. We tell people to emphasize fruits and vegetables, approximately half their plate, then whole grains the other quarter, and then beans, nuts, and seeds the other quarter. All right. They don't have to do exactly this, but something like this. All right. Then we also tell them to follow some other instructions as well. We tell them to eat generally 2 meals a day, breakfast and lunch. Separate the meals by 5 to 6 hours. Absolutely no eating between meals, so no snacking. All right. Whole foods. So we're not talking about Coke and Oreo cookies, which are vegan. We're talking about whole foods that you cook yourself. Drink water and not soft drinks and alcohol. Okay, and then of course moderate amounts of exercise if possible. All right, so usually we start people off with some walking if they're not used to exercising, if they're deconditioned. But if they're physically active, then we encourage them to keep on doing that. All right, so we tell them to do this here, and I'm going to show you some of the results that we do get. Okay, so first let's discuss weight loss. All right, can whole foods plant-based nutrition help people lose weight? All right, so here this is an individual who came to our clinic in 2019 January. They enrolled in our program. It's a 6-week follow-up program, and we tracked them for 6 weeks, and then we let them go. And we follow them up every few months. Okay, as you can see, they started at a heavy weight, 214, and this individual, as the weeks went on, as you can see, the slow, steady weight loss. By the end of the program, you can see she lost about 10 pounds. Now it's very interesting. As you can see, this was January 2019. So we released her from the program. We followed up with her in October 2019. Her weight had dropped to 185. All right. I just got a message from her today that her weight is now about 179. All right. So as you can see here, and this individual, she followed the program to the T. Right, 2 meals a day, no snacking, whole foods, plant-based, um, things like that. Okay, and you can see here, sustained weight loss that has been maintained even without the help of our clinic afterwards. All right, so they were able to start the program, and even after leaving the clinic, they were able to actually maintain the lifestyle, and as a result, you can see they've dropped lots of weight. All right. This is waist circumference here. So this is, your belly, right? The circumference of the waist. And you want to see that go down as well. And as you can see, in 7 weeks, it did go down. Okay. So this is kind of what we want to see. All right. This is very different from typical weight loss programs where you do a very calorically restricted diet and it works for several months and then the weight comes right back on. But as you can see for this individual, this is not what happened. All right. So the weight loss is a little bit slower, but it's you maintain it better. Okay. This is another individual who came to our clinic March 2019. As you can see, this individual is quite heavy, 363 pounds. All right. As you can see over the time, over the year, you can see the weight is slowly dropping. Okay. By the end of the year, they had dropped um, 30 pounds. Okay. And we're still continuing to monitor this individual. And I can tell you that they have not gained the weight back. In fact, they're continuing to slowly drop the weight. Okay. So now COVID kind of put a kink in the process, but they have not gained all the way back. Okay, they're still continuing to progress. Right. So as you can see, and this individual as well followed the program to the T. Whole foods, plant based, 2 meals a day, and so forth. Okay, no snacking. All right. And this is exactly what we want to see. Okay. And this is their waist circumference. Okay, as you can see, the waist circumference is going down as well. Okay. All right. Now, this is a male, all right, who came to our clinic, 2018. He's a short guy and about 200 pounds, so you could imagine it's quite heavy. Okay, he started at 203 pounds. Okay, and then we followed up with him in about a month. He dropped down about 10 pounds. Then he was doing so well, we just didn't see him, and then we followed up with him several months later in September, and he was 184 pounds. Okay. And so as you can see, this is exactly what we want to see when it comes to weight loss. All right. And this is produced by Whole Foods plant-based nutrition. All right. Um, okay. This here, and the experience that we're seeing at clinic is backed up by science. Okay. So this is one study, all right. The broad study where they got individuals, they divided into two groups. One group just did standard medical care. The other group was put on a whole foods plant-based diet, okay, getting rid of all animal foods and eating plants. As you can see here, they dropped the weight, all right? I see significant amounts of weight, okay, in about a year's time, okay? And we could show you many studies like this. And so it's not just experience, but it's actually backed up by scientific evidence as well, okay? All right, moving on here. Okay, so when it comes to weight loss, whole foods, plant-based nutrition is not a diet. Okay, it is a sustainable eating pattern that can be maintained for life. The weight loss may be somewhat slower, but it lasts. Okay, I think that is what's really important. So when people want to lose weight, they understandably they want to do so quickly, but we as a doctor, we think about the more long-term success, and whole foods plant-based nutrition is really the way to go. All right, how about diabetes and blood sugar and that type of thing? Can whole foods plant-based nutrition help with that? Okay, so the first thing, hemoglobin A1C, some of you might be familiar with that. That is a measure of long-term control of your blood sugar. All right, 6.5% and above. Okay, 6.5% and above is considered type 2 diabetes. Okay, 6 and between 6 and 6.49, that's considered pre-diabetes, and under 6 is considered normal. All right, so let me show you. This individual here came to our clinic, had an A1C of 7.1. This is clearly diabetic. Right, this individual is clearly had type 2 diabetes. In fact, they were on several medications. We told him to go whole foods, plant-based. All right. 5 months later, and this individual followed the program to the T. 5 months later, A1C dropped to 6.1. So they went out of the type 2 diabetes range, and then they're now in the pre-diabetes range. All right. And so this is exactly what we want to see. All right. And this was done through pharmacological intervention along with lifestyle intervention, whole foods, plant-based nutrition. Okay. In fact, this individual is starting to shed some of his medicines because he's doing so well. All right. This is another individual. This person had pre-diabetes. All right. And so they were concerned and came to us. We told them to do drop the meat, drop the animal products, go whole foods, plant-based. As you can see, they started as a pre-diabetic, and then their blood sugar is normalizing. Okay, so that's the blue line you see there. It dropped. Okay, so this is what we want to see. As you can see, that was in about 2 3 months. Okay, which is really good. Not only that, their inflammation levels drop. So this is C-reactive protein. So when people have chronic diseases, often they have high levels of inflammation. Again, you can measure that through a marker called C-reactive protein. And you want, if not, 5 and above would be considered high. So this person was quite inflamed. They're at 9. Okay, but then they dropped to 3.6. Okay, so which is very good. And this was, again, through a healthy lifestyle, getting rid of the animal products, getting rid of all the processed junk, sticking with whole plant foods, 2 meals a day, and drinking water. Okay. All right. Now, something I really want to emphasize, and this is an experience that I had, and it really stood out to me, and uh, and I want to share with you. So, when you do a blood test, and the doctors look at you and they say everything is okay, you have to be careful because it might not be. All right. I think this is very important for patients to understand. All right. That whenever, just because the doctor says that your blood work is okay, doesn't necessarily mean that it's okay. And let me explain. Okay. This is an individual who came to our clinic. Okay. And before the visit, she had done a routine blood test, and the A1C came back 5.9. Okay. Now, as I had explained, 6 and above is considered pre-diabetes. 6.5 and above is considered type 2 diabetes. So as you can see, this person is technically not pre-diabetic. In fact, you would say their blood sugar control is normal. But as you can see from this number here, it's only 0.1% away from being in the pre-diabetic range. Okay, I hope that makes sense to everyone. 6 and above is considered pre-diabetes. This individual's blood test came back 5.9. That means that they are technically normal, but they're only 0.1% away from being pre-diabetic. All right. But when the doctor explained the blood test to her, the doctors just said, everything's okay. And that's kind of true. However, the patient was very concerned because she was only zero point 0.1 away from being pre-diabetic. So they marched into clinic, and so we said, since this test was several months ago, let's do another test. And so we sent her off for a blood test to test hemoglobin A1C, and lo and behold, it came back 6.4. So now she was pre-diabetic. In fact, she's pretty close to being full-blown type 2 diabetes. Okay. And so this individual did the right thing. She noticed that her blood sugar control, though it was technically normal, that it was high enough for her to be alarmed. And after several months, when she took the initiative to come and do the test again, indeed, we detected that indeed, metabolically, she was actually not normal. Okay, or at least it progressed rapidly. All right. Right now, we have her on a plant-based program, and she's struggling a little bit to implement plant-based nutrition, but she is trying, and so we're going to see how that turns out. All right, so keep this individual in your prayers. But in any case, I think this is a very important lesson for all of us, that just because your doctor says everything is normal, you have to really look at your blood test results yourself and scrutinize it carefully. Okay. All right. There's just some more data here. Okay, so this is the position paper from the American College of Lifestyle Medicine in America, okay? And they just released, I think it was last month, they just released a position paper on lifestyle interventions for reversal of type 2 diabetes. And I want you to notice what they say here. Research now reveals that sufficiently intensive lifestyle interventions can produce remission of type 2 diabetes with similar success to bariatric surgery. Okay, so why did they mention bariatric surgery? Well, it's because When you get obese individual with type 2 diabetes and they go through gastric band surgery for their weight, they drop tons of weight. And just by having that surgery alone, they could essentially reverse type 2 diabetes. But what this paper is saying is that through intensive lifestyle interventions, you can actually get the same results as bariatric surgery. All right. Continuing, they say, we recommend that type 2 diabetes remission by intensive lifestyle change be the primary modality for type 2 diabetes care. Notice these words, remission, or another term would be reversal. Okay, so reversal is possible, and lifestyle intervention should be the primary modality. So if there's anyone here listening today who is who has type 2 diabetes and all you're doing is just managing through drugs, okay, that is secondary therapy. That should not be primary therapy. Primary therapy should be intensive lifestyle intervention. And when you read this position paper, they're very clear that plant-based nutrition is really the way to go. All right, the last thing I want to share before I turn over to Carolyn is rheumatoid arthritis, right? And we're seeing some good results with managing patients who have rheumatoid arthritis, right? So I just want to share just one case study. Okay, this woman came to our clinic and she was struggling. She was on the highest dose or very high dose of methotrexate, a drug that's used to suppress the immune system that's supposed to help with rheumatoid arthritis. She was in intense pain. She came to clinic seeking a natural option. We told her to take some supplements, but also to really focus on transitioning her diet to plant-based nutrition. She is essentially, that's what she did. And I want to show you her pain scores throughout the different visits. Okay, so initially, essentially, she said, her pain was 10 out of 10. It's just unbearable, just really lots of pain. By the second visit, several months later, it was 8 out of 10. Third visit, several months later, now it's half. All right. Interestingly, when she came in, she was no longer able to exercise. By second visit, she was exercising once a week. Now she's exercising twice a week. All right. And it's interesting, her medication use also dropped as well. Initially, she's on 25 milligram doses of methotrexate. Now she's on nearly half, or actually essentially half of that dose. All right. So again, you can see the beautiful power of lifestyle medicine, of plant-based nutrition, to help individuals, even with diseases like rheumatoid arthritis. All right. All right. So conclusion: whole plant-based nutrition is perhaps the most optimal way to eat for most humans, especially here in North America. It can not only help prevent, but also potentially reverse many of today's leading diseases. Okay. The evidence exists through both science and experience, as in we have the evidence, the scientific evidence to support what we're doing, and we have actually experienced that evidence in clinic. All right. And lastly, we can no longer settle for managing with pills, tablets, and injections when reversal is potentially possible through food and other lifestyle interventions. All right. This is not to say you should stop your medications. What it is to say that if you're only taking medications to deal with hypertension, uh, um, type 2 diabetes, and rheumatoid arthritis, and other conditions like that, then you're really missing the boat. You need to combine, you need follow your doctor's instructions with drugs, but also you have to really focus on lifestyle interventions as well. All right. With that, I'm going to turn it over to Carolyn, if that's okay, Daniel.
Yes. Thank you so much, Dr. Cho. Carolyn, you there? You can
Yep,
share
I'm
your
here.
screen.
Yeah, I can, except I can't, the video won't start, so I don't know if I'm blocked from that. It says
Let me ask
it's
to start
just
video.
not allowing me to, it was working before. So maybe I don't need to be on video. Has asked you to start my video. It's failing to start. I don't know, do you want me to reboot or just to continue?
If you want to,
let me just come out and I'll come right back in.
sure. In the meantime, Dr. Cho, we got some questions. If you want to take some questions now for you.
Sure. Let's do that.
Yeah. So while we wait for Carolyn, we have a few really good questions actually. So do you ask them to count calories? This is a question from John.
That's an excellent question, John. Interestingly enough, we don't. We tell them not. They don't count calories. Some choose to do it on their own, but lots of the examples that we show you today, they don't count calories. All right. So when you're eating 2 meals a day, whole plant-based nutrition, emphasizing fruits and vegetables, often you don't really need to count calories. That's our experience. Okay. Sometimes we do tell people to take pictures of their meals so we can kind of monitor, kind of get a sense of how much they're eating, but we don't tell them meticulously, log everything that they're eating, get the calories and all that kind of stuff. We don't do that. Okay.
Okay.
Yeah, so unfortunately, I can talk, but my video won't start. My camera won't kick in again.
Okay.
It's very strange. What I can do is I can use.
Carolyn, do you just want to share your screen and maybe just be on audio?
Yeah, I think that's the best way to go.
Sure.
And what I can do is I can maybe Zoom from my phone for video. I don't know if that would. I can be 2 people.
Sure, you can try that. Yeah.
And
let's try that.
Call over the internet and start video.
Oh, there we go. We see you.
Yeah, but so I'll share screen from here.
Sure, no problem.
And I'll just try to be in both places. So it's wonderful to be a part of this amazing program. My name is Carolyn Nichols. I'm a certified holistic nutritionist here at the Energy Shack Juice Bar. So we're located in Scarborough East, Midland, and Progress, very close to the Scarborough Town Center. And basically, what I'm going to share with you today is in the same lines. I'll share my screen. I wasn't putting my screen on yet, but I will. I'll start it.
Great. Carolyn, we see your screen.
Okay.
Perfect.
Awesome. What I was just sharing is that we're here at the Energy Shack Juice Bar. I am a certified holistic nutritionist. However, we also do smoothies, juices, vegan meal prep program, detoxes, so the whole gamut. I do free consultations and I work very closely with Dr. Cho so that clients of ours can see both a nutritionist and a naturopathic doctor. I have had the privilege over the 4 years that the Energy Shack has been open, but for 10 years of being a nutritionist, I've had the privilege of watching stage 4 cancer go away naturally. I've had the privilege of watching, we just have a 100% success rate at lowering blood sugar, blood pressure, digestion issues. There isn't a client that comes through our care that doesn't leave better than we found them. And I just very excited to share this with you. And I have some real life pictures of real life people that have gone through it. And the beauty of being in my position here is that I get to go on this journey with people of all walks of life. So whether you come to me as a teenager or whether you're, in your prime years, in your 70s, when you can use food as your medicine, when you can follow what we like to call the 8 laws of health, you really can reverse almost any disease. So that's what I'd like to share with you today. And you will have to forgive me if you hear some background noise because I am at the juice bar. So sorry about that, 1 second. wondering if you take that out. Thank you. So I just want to share with you Shannon. She's a young lady. When she came to see me, her picture is to the right of when she first came to see me. Yes, struggling a little bit with weight. I mean, she's not obese or anything, but she definitely felt like she had about 30, almost 40 pounds too much on her. So Shannon's biggest problem was that she was always tired. You know, Shannon's in her late 20s and she's just fatigued at all times. But also the problem is that she's covered in hives. It comes and it goes and it comes and it goes. And she's seen dermatologists. She has seen, you know, all sorts of specialists. You know, she's tried the cortisol cream, different injections, and nobody can pinpoint it. She can't figure out what's creating the hives. When I met with Shannon and did the assessment on her, I could tell that there was just a toxic overload. She's a very light sleeper, so cortisol is high all the time because she doesn't get enough sleep. And as we did our program, so I do a 30-day program, very similar to Dr. George Cho, and we actually work together on many of our programs. Again, moved her to a completely plant-based diet. We started with the detox, and I have to tell you, as I warned her, she had eczema and hives. I said they're going to get worse before they get better as we started the detox. And she went on a 5-day juice cleanse. She got really bad hives, and she wasn't too worried. Her eczema got worse, but I have to tell you that by our 30 days, she had not had a breakout for weeks for the first time. Eczema was 0. She was so energized. She was sleeping deeper. She thought that genetically she was just a light sleeper, and she is, but her food was really creating more of an issue for her during her sleep. So took a picture of Shannon, and there she is to the left. She has lost just over 30 pounds. And this is just about, so it's about 2.5 months after. So as Dr. George Cho has mentioned, Shannon and I did a program for 30 days, wrapped up the program, gave her a maintenance plan. I was really proud with her success. You know, she had lost 15 pounds, but she continues to come back. She continues to follow this lifestyle, and she still feels amazing. And it's now been 2.5 months, and you can see Shannon there. She no longer has hive breakouts. And have we figured out, was it a trigger? Was it something she ate? No, we haven't figured it out, but she has learned that by following this plant-based diet that she's not having the breakouts and the eczema is gone. So her system is clean and she continues to detox. Does she ever have a treat once in a while? She sure does, but her body doesn't respond in such a negative way. Am I saying that there aren't any plant foods that people could be allergic to? There definitely can, but in Shannon's case, as I pinpointed when we did the assessment, she had a major toxic overload. There was no question about that. I want to share a picture with you of Alex. When Alex came to see me, he had tons of joint pain. Again, such a young person. He was rapidly gaining weight. But what was bothering him most was that he was having tons of bloating and acid reflux. And he couldn't, again, figure out, sometimes he'd realize if he ate greasy food, it would happen if he didn't. But it was so back and forth, he couldn't figure it out. Again, Alex started off with a detox. He chose a 5-day as well. We have a 2-day, a 3-day, and a 5-day. But for him, because there was so much joint pain at a young age, I really wanted him to go long on that one. So this picture is literally 3 weeks after he started. It wasn't even at the 30-day mark. I mean, you can see his skin is brighter. You can see a major change on around his waist. I have to tell you, and Dr. George Cho also commented on it, that when you have that belly fat, that's a real dangerous place to be, because the more fat you have stored around the middle, you're holding a lot of toxins there. That's covering your intestinal tract, that's covering your stomach. And this is where in your intestinal tract is where like 80% of your immune fighting cells are living. You do not want toxins sitting around where your immune system is trying to fight and be strong. So a big belly or belly fat is really a major problem, and it puts a lot of weight and trouble on the cardiovascular system. So very quickly, you can see that Alex had made a major change in less than 1 month. And I'm happy to say that he never had one bout of acid reflux, and bloating was gone immediately. And when I asked him about the joint pain, he said, "What joint pain?" So that's really awesome. Here again, we have another young person, and I will share some few more seniors with us shortly. But I just wanted to show you that, some people can look healthy. Catherine is actually a personal trainer. She's also an athlete. But she has really, really bad IBS, and she just muddles through it all the time. She's scared to eat anything. She has a very weak immune system, and she always has this acne breakouts, and she struggles with low iron. So she was a meat eater. She was trying to move more plant-based, but she struggled with her iron component. And I have to tell you that it's an absolute myth that your iron would be low on a plant-based diet. The iron that you get from plants is definitely, your body has to work harder at taking it out. So sometimes when you move from eating meat to going plant-based, there's this initial drop, but if you do it properly, there can be a great pickup of your iron, and it's more usable and useful to the body, the iron that you get out of plant-based food. So I'm happy to tell you that I went 6 weeks with Catherine. When I have an IBS issue, I have to go through an elimination diet, and there's a specific protocol. So we change the diet gradually as we go. We have to start off with really soft foods, and then we gradually have to add things in. So our 30-day program wouldn't cut it. We had to go 6 weeks. She started off with a 3-day detox, and told me that she has always knocked detoxes and told everyone she would never do it. I gave her no option. And so as we went on this plant-based diet together, starting with a detox, I have to tell you that Catherine, as maybe this is too much information, but after 6 days, she called me from the bathroom, and she said, because when I'm your nutritionist, I stay in touch with you at all times. You won't have to call me from the bathroom, but she was in tears. She said that she's never had bowel movements 2 days in a row that don't hurt her. And it just changed her life. And from that day forward, she never had trouble with bowel movements. The bloating was gone. She couldn't believe that when she ate food, her stomach didn't hurt her. Now, the truth of the matter is her food wasn't her issue. To some degree it was, but because Catherine is a bit of more of an anxious person and someone who went through a lot of emotional stress, that's what caused this IBS issue in the first place. But once we learned how to, and we had to go through capturing anxious thoughts and learning how to, count your blessings rather than worrying about things you can't control. So there definitely was some other aspects of it there, but then we had to change the diet, heal the lining of her stomach, start with soft foods, enter into some much easier to digest plant-based foods. And today, Catherine is just a new person. She has an absolute new lease on life. I want to bring to you Joan. I love Joan so much. I love every one of our clients, but Joan is just, she is such a testimony. And her story is incredible because Joan, you can see to the left, she had a stroke. She ended up having triple bypass surgery. So you can imagine someone on triple bypass surgery is going to end up on blood pressure medication. She was on cholesterol medication. She had blood thinners, bad acid reflux. She had tons of weight on her that she did not need. And she was scared. She was scared. So when she came to see me, I said, Joan, there's just no option, but you'd have to do a complete plant-based. I don't want to put you on the detox starting. So we didn't start with the detox. She was just on way too much medication. But I have to tell you, it has been 2 years. Joan is medication-free. Medication-free. And this happened within the first 6 months. In fact, in the first month, she was dropping her medication rapidly. but it's been 2 years and Joan is still medication free. She is like, you know, we don't want her to lose any more weight. She just looks fantastic. She showed up at our gala last year in a dress that she said she hasn't worn since she was like in her 30s. Joan is pushing on 65. So she just, as I tell everybody in our program, it's like we have found the fountain of youth. You get younger as you get older. I myself, I'm 45, and when I look in the mirror, maybe you don't think so, but I'm just impressed that my skin is still glowing. I feel great. You know, I'm just happy with my appearance, but this doesn't come just by genetics. This comes because we're eating live, fresh food and not snacking all day, not eating at night, 2 bigger meals in the day. So it's really amazing. And finally, I just want to wrap up these testimonies. I had a hard time picking which testimonies to share because there's so many. Every day at the Energy Shack is a testimony. It's incredible. I love this couple. They have such a precious story. This is Ray and Lydia. Ray is now 71, but when he came to see me, he was 69 years old. And Lydia was just a few years younger than him. When Ray came to see me, he had already suffered a heart attack. I mean, that, you know, living through a heart attack, I can't even imagine. Of course, he was on blood pressure medication, a lot of it. He was on blood thinners. And his doctor told him his blood sugar was high, and the next step, he is going on blood pressure. He's going to be on metformin. Lydia had suffered shingles before I met her, but although it was a year ago, she was still suffering with pain all over her body, extremely dry eyes, and a very low immune system. She had insomnia, so much trouble sleeping. And the thing that really tugged at my heart is that when Ray and Lydia sat before me, they're retired and they just bought a new home in Pickering area. And the thing about it is Ray's a handyman. So he had all these intentions of building a deck and you know, fixing all the trees in the front and building a nice patio. And he had all of these intentions. And he said he would go out, he'd work for a few hours, he'd have to come in and sleep, go out, work for a few hours, come in and sleep. And he wasn't enjoying this new retired life. The other problem is that it really scared him when his doctor said that he was going on medication for his blood sugar now because he was on so much meds already for blood pressure, cholesterol, and his older brother and father both died of diabetes on the same medication his doctor was just about to prescribe him. So Ray, you know, just was on a typical standard American diet, I guess you could say, you know, meat and potatoes, a few steamed vegetables. And I said, Ray, Lydia, the only way I can help you is if you're willing to follow these laws of health. Again, I couldn't put them on the detox right away, but we ended up doing that at the end of the program. I have to tell you that Ray, within the first week, had to drop his blood pressure medication completely because his blood pressure dropped so low. The week after, his doctor took him off his blood thinners because his blood pressure continued to drop. At the end of our 30 days, he was completely out of the woods for his blood sugar issues. As well, his cholesterol meds were not needed anymore. He had no more joint pain, so not even less. There was no more joint pain. Ray came in here skipping literally, like as if he was back to being 17 or something. He told me that his neighbor was getting upset with him because he was climbing trees and he was debranching them himself. He never needed naps anymore. Lydia could not believe that her body was just dehydrated. As I got her to drink water and stop drinking tea, she no longer needed her eye drops after 3 days. And of course, her post-shingle pain did not exist, and she began sleeping like a baby. Again, this is just such a few testimonies of people that come through the door. I haven't had a client that has come through our program and done 30-day program with us and hasn't experienced incredible healing. I don't have one diabetic, one person with blood pressure, one person with digestion issues that doesn't feel incredibly better. And you know, as far as we do our program, it starts at free. I will do a free consultation with you. You just go to our program. You go to our website, Energy Shack Juice Bar. Click on free consultation and watch that video. It explain the 8 secrets of healing, and then below there you will see a health intake form, and you can fill in that intake form, and I will get in touch with you in 24 hours and set up the free consultation. And that form allows you also to have Dr. George Cho be part of the program with you. Of course, you could spend $2,000 on your program if you want to, because we have a chef, she'll make all your meals. You can get the detox here, you can get everything done for you completely, have your own dedicated nutritionist, but we decide together what program suits you. And again, it starts at free. And even if you don't ever contact us, if you just go to our website, click on free consultation and watch that video, the 8 secrets of healing, it will change your life if you could follow those principles. We've had the privilege of reversing naturally stage 4 cancer. And some people come through our program and they're already taking chemotherapy and radiation, but their immune system is low, their body's burning from radiation. We put them through the program and they're like alive again. So even if you are going to go with conventional medicine, because I saw that question about the cancer, and I know we're going to do some questions afterwards, but even if you're going to go with conventional medicine, if you are suffering as a cancer patient, we can just help you get through it and recover much quicker so that the cancer doesn't have a fighting chance once you're done with your therapy. But of course, there are natural ways to reverse pretty much any type of cancer if you can catch it early. So from fibroids, digestion issues, depression, diverticulitis, Crohn's, there almost hasn't been a disease we haven't seen here. We work with a lot of sickle cell anemic people, put them right on plant-based, and guess what? Their iron goes up. People that are smoking, we are able to get them to break the habit. I mean, I really could be here all day. But I'm just going to pass it back over to Daniel Cho so that he can lead the question and answer period. And thank you so much for listening.
Wonderful. Thank you, Carolyn, so much. Those are really powerful stories, I must say. Thanks to Dr. Cho as well. We do have a few minutes for questions. So if you have been listening and you have a question, please put them into the chat box and we'll try to get to as many as possible. All right, so let's just go through them one by one here. So we count calories. We have a question from Mariana. Mariana, thank you so much for joining us. I think this was directed to Dr. Cho. Do you ask them to count macros? I think this was part of your weight loss segment there. So do you count them? Do you ask them to count macronutrients, and how do you determine how much food they need to eat? Similar to the calories one, I think.
Yeah, great question. We do not get them to count anything. They don't count macros. They don't count vitamins and mineral intake. They don't count calories, nothing. All right. We tell them just those simple principles we explained at the beginning. Eat mainly 2 meals a day, separated by 5 to 6 hours. No snacking in between meals. Whole foods, plant-based. The way that we keep track of these individuals is that first we tell them to take pictures of their meals so we can objectively, visually see what they're eating. And then also when they come in every week, we ask them, did you do this? Did you do that? Did this? So they kind of give a report. But if people are eating whole plant-based foods, we don't feel it's necessary to count macros, and we've seen success without it. So I think the easier that we can make it for people, the better it is.
Yeah, okay.
Some patients do though. Some patients are very meticulous. They get the MyFitnessPal app or whatever that app is, and they meticulously count everything. That's fine. I mean, we don't discourage that, but really, you don't need to do that to lose weight.
That's right.
Okay.
And I'd like to add to that, if it's okay.
Yeah, go ahead.
It's important to have a raw component before the cooked component. So before you're going to have your whole grains for your breakfast, you'd want to have 2 to 3 fresh fruits first. What a lot of people are missing in their diet is live, fresh, raw food. So you want to have your 2 to 3 fresh fruits, and then you have your whole grains, your nuts and seeds. You wait your hour or two before you even drink water. And then your next meal, as Dr. Cho rightly said, 5 to 6 hours later, would then be a nice big leafy green salad first, and then your plant-based cooked meal. So you probably are wondering, like, how could a meal leave me full for 5 to 6 hours without counting macros and carbs? You don't need to, as he said, but if you have your raw food right before your cooked food, it helps with digestion, helps with everything actually. And of course, if you are struggling with diverticulitis, Crohn's, IBS, you might not be able to have that much of the fresh food component. And that's where you would just reach out to us individually.
I love it. The practical nutrition advice from the nutritionist. All right. Great. Thank you, Carolyn. This one I want to hear from you both. It's from Christelle, I think. Thank you so much for being here. I think this was first asked to George when you were speaking, so I'll just throw it to you first, but then Carolyn, feel free to jump in. Dr. Cho, you mentioned that you asked to eat only 2 meals a day. Why is that? Why not the dinner?
Right now, there's good scientific evidence to support the idea of like intermittent fasting or time-restricted fasting. So this is like the idea that you eat within a certain window of time, about 16-8. So about you eat in an 8-hour window of time. So if you look at those 8 hours, it's not good for digestion to just eat whatever you want anytime during those 8 hours. Right? You need your food needs your digestive system needs time to digest. So 2 meals a day. Now, of course, breakfast is the most important. Then you have lunch. Generally speaking, I mean, some people have different work schedules, and we have to kind of work with that. But I'm speaking in general terms. Now, I tell patients if they want to have a third meal, they most certainly can, but they have to keep it light. Right, but we strongly recommend that people stick with 2 meals a day. And then some people say, well, I'm gonna get hungry. Well, if people are eating whole plant foods, all that fiber will help people stay satiated for longer. If people want to eat a third meal, a light dinner, I mean, they're free to do so. So then we recommend, maybe do a little like a fresh juice, maybe a little bit of fruit or something like that.
Okay, great. Carolyn, any thoughts on this one?
Yeah, just also listen to your body. So just like Dr. Cho said, if you need a third meal, don't eat just because your family's eating, so you want to have a third meal, even if it's just going to be small. The biggest thing that our clients tell us on our program is that they've learned to listen to their body, drink when they're thirsty, eat when they're hungry. Many times we eat because it's quote unquote lunchtime. It's our lunch break, but we're not hungry. You got to listen to your body and don't interrupt digestion. That's a major problem for most every health issue, because as our program is called, food is your medicine, but that food won't properly be your medicine if it's not being digested properly. So listen to your body. If by the 5th hour or the 6th hour you're still not hungry, just keep drinking water until your body says I'm hungry. Then maybe you got to make your meal a little smaller if it's pushing you 7 hours. So yeah, if you're hungry at night, have something very small. But if you're not hungry, just drink water or herbal tea.
Wonderful. Thank you, Carolyn.
And I want to just add something here, Daniel. When people come to do the weight loss program, we show them a study. And in this study, they gave two groups of participants the same amount of calories, the exact same number of calories, but they ate the majority of their calories at different times. One group ate the majority of their calories, half their calories at breakfast. The other group ate half the calories at dinner. Okay, calorically, the caloric content was exactly the same. So calories was not a factor. It was just the time of the day that they're eating those calories. And lo and behold, the group that was eating most of the calories at breakfast time lost much more weight. So I think it was about a 10-pound difference compared to those who were eating large dinner. And those who were eating a large dinner, they reported feeling hungry all the time, whereas those who were eating large breakfast, reported being more satiated. That means that they felt more full.
Mm.
Right? So there's something about front loading your calories that makes a difference. Right
Yes.
now in our society, we have everything backwards. People eat a donut for breakfast and they go and have a big dinner. That's really,
Right.
really counterproductive. Large breakfast, then a lunch, and that really should set you up pretty well.
Okay. Wonderful. Okay, we have a bunch of questions, so I'm going to ask Dr. Cho and Carolyn just to be more quick on these next couple ones.
Sure.
We have a question from Linda. What would you recommend for a person whose A1C has remained at 6.01 for over 6 years with no change? Hey, Dr. Cho.
It's hard to answer this question because we don't know the context.
Okay. Yeah.
Is this person plant-based? That's the first question, right? Also, if you look at the guidelines for diabetes management, exercise is also a huge component as well. So exercising, are they exercising? Meaning the recommended guidelines. So 150 minutes, moderate vigorous physical activity per week. Are they doing that? You know, factors like that I think are important. If they're plant-based, and what type of plant-based are you? You
Yeah.
know, Coke and Oreo cookies are vegan, or French fries are vegan, right? So donuts can be vegan. So so there's a lot of we don't know the context here, but you know, I think those are some things to think about.
I would also say that you are welcome to just reach out to us, click on free consultation, and allow me to do a free assessment of your health. And I would be able to, as Dr. Cho said, by finding out your background, your context, you'd be surprised. There could be something small you're doing that hasn't brought it down.
Awesome. Thank you, Carolyn. All right, we have a question from Zelda. Thank you so much for joining us today. Is it true that diabetics should have less fruit because of sugar content in the fruit?
I'd love to answer that question.
Go ahead, Carolyn.
Yeah, you
Hey,
know,
just
it's
quick.
funny. I just spoke with one of my diabetics last week, and he said, I can't believe I'm eating fruit. I thought I wasn't allowed, and my blood sugar's dropping. I have type 2, type 1 diabetics on my program who have drastically reduced their insulin so much that her kidney function went up 1%. Can you imagine? And she thought she was never allowed to eat fruit, and we allow her to eat fruit on the program. Like, what is that? So it depends. When are you eating your fruit? Which fruits are you eating and how much? So I don't think we have time for all of that. But as a diabetic, yes, you should still be able to eat your fruits. You want to go mostly berries, and you want to eat your fruits right before you eat your whole grain so that the fiber can help regulate the sugar into the system. And you don't want to be snacking on fruits all day because that's a problem too.
Mm-hmm. Okay.
Carolyn made these excellent points. Fruit is safe for people with type 2 diabetes if you're willing to make the lifestyle intervention, the lifestyle changes. If there's an individual who is not willing to make the lifestyle changes, then you're not addressing the root cause of the type 2 diabetes.
Exactly.
Therefore, adding lots of sugar of whatever type might be detrimental. But if someone is transitioning to a whole foods plant-based diet, they're addressing the root cause of the type 2 diabetes. And therefore, adding fruit is actually going to be very healthful, not detrimental. So again, I completely agree with what Carolyn's saying. Vilifying fruit when it comes to type 2 diabetes is really misplaced and misguided. And there's
Yeah.
really no evidence, zero evidence to support that idea.
Okay. Okay, we have to wrap up soon. We have a question from Erico. Thank you, Erico. Carolyn, this is, I believe, was submitted when you were talking. How about breast cancer? Do you have a testimony about breast cancer?
Yeah,
Really
I
great
actually
question.
see quite a few people with breast cancer. I unfortunately, the reality is people come to see me generally after they're fed up with doctors. That's the truth. People don't usually have cancer and come and see me first. That really, it's happened twice in my experience, and anyway, we sent them off to a wonderful lifestyle center because it was early, and they were able to reverse it in a different environment using the 8 laws of health. But I've had a number of clients that have seen me. Marlene is one of them, and I'd be happy to put you in touch with her, where I saw her after all her radiation chemotherapy, but the lump was starting to grow again. And she came to see me. She said, I can't go back to radiation. I can't do it. We put her on the program. 6 months later, she went to her doctor, and it was like so small, almost not even there. So that, because the truth is, after radiation chemotherapy, it doesn't mean it's gone. It's not an answer for cancer at all. But so yes, lots of experience with breast cancer, lots of testimonies. No time to share all of them, but again, you can get in touch with us directly by just going to our website, click on free consultation, and fill out that form.
Okay, wonderful. And I did put the link in the chat box for those who are interested. I'm going to put the our email into the chat box. We are out of time, and we do like to end on time for these events. So there's an email address. If you have a question, feel free to reach out to us, and we'll forward it to Dr. Cho or Carolyn. So just want to thank you for joining us so much. I want to thank those who are watching on Facebook. I want to give a special thank you to Carolyn and Dr. Cho for those really powerful stories and just the inspiring testimony. So thank you so much. Please do check out our website, www.lifestylemed.org, and to check out for our upcoming live events. We do these bi-weekly, almost sometimes even weekly. So please do check it out, and we'd love to see you at a future event. So again, thank you so much, and we hope you have a wonderful rest of the evening. Thank you.
Thank you, everyone.
Yeah, thank you, guys.
Thank you.